Well, we're in a new era with all this talk about variants of the coronavirus, COVID-19 pandemic virus. And right now the big news is the Delta variant. You know, viruses mutate all the time. We all know about this because of the flu virus. Every year we have to get a new vaccine because there's a variant of the flu virus. What's been a concern is even if you're vaccinated, it doesn't prevent you from getting the virus into your nose, the Delta variant virus. Now, if you get the Delta variant virus, you don't get that sick. You might not get sick at all, either no symptoms or very mild symptoms. So you're protected against the Delta variant. However, recent research shows that you can carry the virus in your nose, and as much virus as if you were not vaccinated. What that means is that you're contagious. You're contagious as a parent to your children, as a worker to your coworkers, to your grandparents, to the whole community. And unfortunately, that's what's feeding the rise in the pandemic, which was predicted by the CDC if we didn't get enough herd immunity, enough people vaccinated. So sometimes we might be thinking about how do these vaccines stop or slow the rise of COVID cases? And they work like all other vaccines. Think about measles. How many cases of measles do we see today? Almost none. Why? Because almost everybody is vaccinated against the measles. What does that do? It prevents the transmission of the virus. Measles is a virus. It prevents the transmission, the respiratory, through our nose, through our cough, through our breath, on our hands to a countertop. So the more and more people who get vaccinated, the more and more people who will not contract the disease themselves. And although we can see some contagion one to another, even in vaccinated persons, that contagion is generally lower as you get the pool of people who are vaccinated getting bigger and bigger. Look at measles. It's gone, pretty much gone, except when there are little pockets of communities where they didn't vaccinate. Then it'll come back. It'll be in that community and can spread from that community to the broader community. That's why we've got a public health obligation, not only for protecting ourselves, but protecting others to get vaccinated.